High blood pressure, it affects millions of people. In fact, 1 out of every 3 Americans. And if left untreated, it can be deadly. Most people take medication to control it. But as Kate Merrill shows us, some patients have found a simple way to keep their numbers down without drugs.
The mad dash to get the kids to school. The crazy commute. And especially work. It's enough to raise anyone's blood pressure.
We work on deadlines, and with all the law changes, which keeps me in business, but keeps us also pretty stressed out.
Soon, that pressure from running his Cambridge accounting firm began to take a toll on Adrian Kaspar. He was forced to go on medication to control his blood pressure.
I believe in not taking medication, but blood pressure you don't fool around with.
I just have you sit right here, Adrian.
That's why he came here to Dr. Peter Martoni, a Linfield chiropractor, who's using a new adjustment in the neck to help bring down blood pressure.
Now, if a bone is out of alignment and putting pressure on the nerve, it interferes with the ability for the heart to function correctly.
In about 2 or 3 weeks, my blood pressure was normal.
Bill Bird of Stoneham sells cars, another stressful job. He was also on blood pressure medication. After a few visits to Dr. Martoni, his doctor cut his medication in half.
Another 30 to 45 days, my blood pressure staying at the levels it is, I'm going to be off at 100%.
This treatment is experimental at this point, but studies show it might actually work.
This is a very novel concept.
Dr. George Bacris is an expert in high blood pressure. He's conducted a small, carefully controlled study with some of his patients at the University of Chicago Medical School. He sent them to a chiropractor for the same adjustment Dr. Martoni uses.
We saw miraculous changes in blood pressure. We're seeing 12, 13 millimeter reductions in blood pressure.
The results were dramatic enough to catch the attention of the federal government. The National Institutes of Health is now funding a larger study to see if they can duplicate the findings.
Even Dr. Bacris admits there are a lot of unanswered questions.
I think we'd have to really find out what's going on. Why is this happening?
But Adrian and Bill say they have all the proof they need.
I've never felt better.
I just feel better, and feeling better is the way to be.
It's tough to argue with an outcome like that. Kate Merrill, WBZ News.
Dr. Bacris and Dr. Martone say patients should not stop taking their blood pressure medication without talking to their doctor first. Now, we posted more information about the study online, WBZTV.com. You can search blood pressure.